Hello, Dr. Watanabe. It's nice to meet you.
Nice to meet you.
So today I'm going to be talking to you about your experience as a modern medicine practitioner and how you've dealt with patients that have been practicing traditional medicine on their own. So can you briefly describe your medical specialty and how long you've been practicing?
Sure. So I did my internal medicine residency from 1983 through 1986 in Memphis, Tennessee. And internal medicine at that time consisted of covering the emergency department, the intensive care unit, and of course all the floors for medical patients. And so we would do intensive care. We would treat people that first came into the emergency department with medical problems. Trauma would go to the surgeons. You treat the problems like diabetes, hypertension, heart disease, heart attacks, strokes, those kind of medical conditions that don't require a surgical approach. And that's a 3-year program.
Okay.
After that, I got out and I started practicing in Indiana. And then in the early 1990s and early 2000s, one of my friends at the time, who was a radiation oncologist, said I should really be looking into acupuncture. He had actually gone and done some acupuncture training himself, and said it had a lot of applications in internal medicine. And certainly the Western medicine with prescribing medications has a lot of usefulness, but it seems to have some limitations. There are some people that just don't respond well or have side effects, or the problems just don't seem to be bigger than what the medications can manage. So I started doing some acupuncture training around 2008. It was about 300 hours of study.
Okay.
And then did some further training to become board certified in what's called medical acupuncture.
Okay.
So the style of acupuncture that I learned should really be called more of a hybrid Western style of acupuncture. It's not a traditional Chinese medicine acupuncture, although we do pay a lot of attention to the understanding of some of the concepts of traditional Chinese medicine acupuncture. But when you talk about acupuncture, you should also say, my best analogy that I tell people, think of acupuncture kind of like martial arts.
Okay.
There are many different styles.
Yeah.
And some people practice this style, some people practice this style, some people blend the two styles, like a mixed martial arts. And of course, everyone says my style is better than that style. But there's your acupuncture that involves body points. There's some that strictly pay attention to the ear, to scalp points. There's even a Korean style of acupuncture that relies on the hand, using points on the hand to represent body points.
Oh, wow. I see. Well, in your experience, what types of traditional medicine do you encounter the most?
Here in mid-southern Indiana, by far away, most people are using some kind of either herbal therapies or supplements, by far and away.
Yeah, has that ever impacted the effectiveness of their treatment plan?
It's difficult to say, because a lot of that would be anecdotal, but certainly there can be some drug to herbal or drug to supplement interactions, even food. A great example of that is that cholesterol-lowering medications called statins, some of them can be fairly affected, their metabolism, by grapefruit. Some people are advised not to eat grapefruit, even though we commonly tell people grapefruit's a healthy food to eat.
Yeah. Well, how do you think the patient's beliefs in traditional medicine affect their overall trust in this new modern medicine?
I think that's very heterogeneous. There's there's some that are very distrustful of any kind of prescription pharmaceuticals. Some of that may be related to their concern about big pharma, versus some people that they just. I'd say the majority of my patients have a blend. Some of them use a lot of supplements of different kinds, particularly vitamin supplements. And then still take the prescription medications too.
Yeah, so when this patient is, distrustful for whatever reasons, as you mentioned earlier, how do you approach the patient about their beliefs and still provide effective treatment?
That's going to be very individualized.
Mm-hmm.
You've got to meet people where they are.
Yeah.
Um, some of it depends on education level too. In the United States, most patient literature that is handed out to people like at the hospitals is for about a 5th to 6th grade education.
Mm-hmm.
So, um, but I don't know if I can give you any kind of generic answer to that.
Okay, yeah.
It really is individualized.
Mm-hmm.
Sometimes people's um, predilection is influenced because they know somebody, either they personally had a bad outcome or they know someone that had a bad outcome due to a prescription medication.
Well, can you share an example of a time when a patient's traditional medicine practices affected their treatment plan?
Um, well, so in my personal practice where I've incorporated acupuncture,
Yeah.
I'd say the vast majority of the people were getting acupuncture for pain management.
Okay.
Acupuncture can be used for a lot of different other conditions, and in traditional Chinese medicine, it's more of a global or holistic approach.
Mm-hmm.
Think about it like an ecosystem approach to treatment versus we're going to take care of this one particular problem.
Mm-hmm.
And so these folks, it wouldn't be uncommon that they would have acupuncture treatment at the same time they're taking prescription medication, or even sometimes going and having like injection therapies, steroid injections to treat nerve root problems,
Yeah,
doing a combination.
I see. Well, do patients usually disclose their practices, like traditional medicine practices?
I think at least around here, most people have been pretty open about what they're doing.
Mm-hmm.
They're seeing, like some folks do see a traditional Chinese medicine trained acupuncturist, but they still come to me for other treatments of other medical problems too.
Mm-hmm.
Sometimes they say that problem's managed by that person, and then I'm seeing you for these problems.
Yeah. So I know you said you practice acupuncture. Do you think there's any other traditional medicine practices that complement modern medicine?
Well, there's all of the herbal therapies.
Yeah.
But I'm not very well versed in it all, other than to know that they're out there,
Mm-hmm.
and a lot of people use them, but they seek traditionally, like it would be someone like an Oriental medicine trained doctor for that.
Mm-hmm. I know it's been a long time since you've been in school, but based on your experience, did your medical education adequately prepare you to handle traditional medicine use?
Oh, other than being aware that there are people that do that,
Mm-hmm.
no, there's no real exposure other than maybe. Certainly back in the 80s there wasn't, and I didn't even think into the early 2000s there wasn't much exposure to that. I do remember there was, just as an anecdote, there was used to be an emergency medicine board question that if you saw a child who had linear bruise marks on each side of their spine,
Mm-hmm.
you shouldn't immediately think that they are being abused physically.
Mm-hmm.
There is a traditional practice called scraping,
Mm-hmm.
where you take something that's got a blunt edge to it and you rub it along the skin on either side of the spine and in other places too.
Mm-hmm.
And the idea is to promote some kind of healing.
Mm-hmm.
So, but that was something actually introduced into emergency medicine board questions.
I see. So, what changes would help the healthcare system better integrate traditional medicine into modern medicine?
I think it is changing somewhat. There's more openness, but
Mm-hmm.
probably the biggest barrier right now to a lot of traditional medicines is insurance coverage.
Mm-hmm.
In the United States, everything is done fee for service pretty much, and so acupuncture is a fee. When people go to see and get herbal therapies, they're paying for the herbal therapies themselves as well as the medical advice to give that. Most insurances, at least around here, do not cover that very well, if at all.
I see.
It was just, I think, about 5 years ago that Medicare started covering acupuncture, but only for chronic low back pain.
Oh, well, so that's like really specific and
Yeah.
niche problem that
Yes,
barely anyone can get that covered.
yeah, but a lot of older
Yeah.
people have low back pain.
Well, going back to your practice of acupuncture, what made you like specialize in that? Like, what was the reason why?
For acupuncture?
Yeah, for acupuncture.
It's just there are things where the medicines only went so far, particularly with pain management. You know, someone with chronic back pain or arthritic pain,
Yeah.
neuropathy pain. The medicines can offer some help, but it would seem like there was kind of a plateau or ceiling of how much relief people could get. And so I was looking for other things that we could add as a complementary therapy to that. Not necessarily in
Yeah.
place of, although for some people, like there are some people that are truly allergic to what are called non-steroidal anti-inflammatory drugs. So that eliminates a whole host of drugs to treat chronic pain like arthritic pain. And so acupuncture is an alternative to offer that, but it would be uncommon to use acupuncture in conjunction with those medications too.
I see. So, what advice would you give future physicians when addressing traditional medicine practices with their patients?
Again, to be open, not to be skeptical. I think, you know, sometimes you hear someone's doing something, we immediately want to dismiss that because it's out of their realm of experience. One of the first rules you learn in medicine is first do no harm. So the question would be anything you're doing, whether you're prescribing a medication or someone's telling you about something that they're doing, is it harmful to them or not? One of the things about acupuncture is the studies that we have, at least in Western medicine, are hard to show dramatic effect or significant effect. But that's due to the nature of conducting studies in part, and also what you're trying to measure. But acupuncture is extremely safe, and so it's pretty rare that you'll hear about someone who had a significant complication of acupuncture.
Well, so when you're like building a relationship with the patient, right, to get them to open up, whether about their traditional medicine practices or agreeing to be part of their effective treatment plan, what do you think is the biggest factor in building that trust?
Well, like with any patient
Yeah,
trust,
with any,
it's well, whether it's that or any other condition, it's listening.
Listening.
You know, if you're cutting the person off in mid-sentence and say, okay, we're going to do this, this, and this, it's not going to go anywhere.
I see. Well, that's all the question I have for you today. So thank you so much for your time.
All right, very good. Yeah. Okay. I did think of someone. There's a Dr. Whitley. Whitley, Windley. He's in Seymour.
Okay.